Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Hillier Cancer Clinic. So let me take this opportunity to talk to you all about a skin cancer, which is melanoma. It is an important thing to understand because though it is among the more common cancers, usually not many people speak about it or discuss about it. Now, skin cancers are one of the more common cancers, the skin being an extensive organ which covers the entire body. Actually, cancers of the skin are fairly common. There can be different cancers of the skin. The three important varieties are squamous carcinoma, basal cell carcinoma, and melanomas. Today I will talk to you a little about melanomas. When we talk about melanomas, they arise from melanocytes. Melanocytes are the cells responsible for the pigment or the skin color. So cancer can happen in these melanocytes, and that is known as melanomas. It is important to know about melanomas because these are very aggressive cancers. Sometimes we see patients with a very small melanoma with very extensive metastasis. So how do melanomas usually occur? So melanomas, the predisposing factor is usually considered exposure to sunlight. When a person is repeatedly exposed to ultraviolet rays, over time these melanocytes can become cancerous. So a few others develop in a pre-existing mole, or what we call as nevus. A few melanomas tend to be hereditary. So how do we identify a melanoma? So most people will have spots on their bodies which are known as nevus. Usually they are quite harmless. But there are a few of these black spots which a patient must be more aware about. If there is a sudden increase in the size of the nevus, and if there is a variegated appearance and the borders are irregular, and there is sudden increase in pain and itching in these nevi, these are the nevi that a patient needs to be worried about and needs to consult an oncologist. So whenever we see a tumor which we suspect to be a melanoma, we ask for a biopsy. We take a small piece of the tumor and send it to the pathologist, who will confirm whether it's a melanoma or not. To stage the melanoma, to see how much it has spread, we may need investigations like a PET CT scan. If a melanoma is confined to one part, only in one region, then the treatment is usually surgical, where we excise the melanoma in a wide manner, say keeping about 1 centimeter all around and keeping enough margin on the depth also. It is important to consult the plastic surgeon if the defect is large and some sort of flap is required to cover. In other areas like on the face, which are cosmetically sensitive, a plastic surgeon may be involved. Certain melanomas, especially on the foot, tend to spread to lymph nodes, and along with the primary, the lymph nodes also may have to be removed. The role of chemotherapy and radiation in melanomas was traditionally considered little less. But now there is a role for radiation, especially tumors which cannot be removed completely, which are too big, or even for chemotherapy. There are drugs available like interferons which can keep melanomas under control. So it is very important to know about melanomas. So if any patient has these symptoms or signs, he seeks appropriate medical attention. Thank you.